name is Dr. Pamela Ballard. I'm a chiropractor in Illinois. The reason for this tape is to explain a little bit about what a chiropractor does if you've never been to one. Chiropractors can vary from person to person, from place to place. Some are more restricted from certain states, and some specialize in nutrition, some do physical therapy, some do just spinal manipulation, so they can vary from place to place. So this is basically what majority of most of the chiropractors that you might go to would do. A little bit about backgrounds of chiropractors. Usually they specialize in pre-med and have a bachelor's of science degree, and then they go on for 3.5 years, 12 months a year to chiropractic school. Chiropractic school consists of basic sciences, clinical sciences, everything from any vascular problems, dermatology, neurology, X-ray, anything to do just like any medical doctor's training would do. The difference is your medical doctor will branch off into more pharmacology since he prescribes medication. And in our second and third and fourth year, we will start branching off into more physical therapy, radiology, and spinal manipulation, which is our specialty. So it's eight years of school approximately, and then we get licensed in the state that we wish to practice in. And from there, I've been in business now 20 years. So I wanted to just explain a little bit about the general questions that a chiropractor would ask before we get started in treating. So we, of course, have to know what the injury is. We also have to know how the patient had the injury, or some of the history of the patient, or if they've had any previous accidents or injuries that could predispose them to more problems. We also have to ask the patient if they're diabetic, if they have asthma, any cancers, tumors, or cysts, if there's heart murmurs, high blood pressure problems, kidney stones, kidney infections, any past history of any type of surgeries, tonsils removed, appendix, gallbladder, orthoscopic surgery, spinal surgeries, foot and ankle surgeries, or any previous fractures. After we get through all the general questions, sometimes they might have a urinalysis if they had any low back pain, to make sure that there was nothing referred from infection. In this case, she's a nice, healthy teenager, however, has some muscle strain in the neck and back area, and she's nice enough to do her demonstration for us as I examine her. So this is Betty, and first of all, what we look for, we stand Betty up, okay, and we look at the spine itself, and we're looking for a nice straight curve instead of a S-shaped curve, which would be a more scoliotic curve. We're also looking at her posture to make sure one shoulder is not riding up or down, and now we also are looking at the curve in her neck and in her lower back. So we are going to have Betty lie face down now, so we can examine the muscles themselves. Okay. And there again, I'm just doing a little bit of light pressure on the muscles itself. I've been doing this for 20 years, so it becomes just a second nature to me. I can feel any restrictions within any joints themselves. In this case, we have a little bit of muscle strain right in the lower right side of her lower back area, and we have restriction up in the joints called facets of the lumbar spine area. As we work our way up into the mid-back area, again, we're going to examine, and again, in the right side of her upper neck, and in between the shoulder blades called the rhomboid muscles are strained. Okay? So now we are going to sit Betty with her back towards our sign here, so we can do a little bit of therapy to show you what we would do as a chiropractor. Okay? Betty, I'm going to have you sit and face this way for me, please. Yep, all the way. Again, there's some orthopedic tests before we get started, and I'll just put a little light pressure down, and I'm feeling the facet themselves, and she would let me know if it's radiating pain. Is that radiating or shooting? No. Not too bad. So that would be more for like a nerve encroachment problem, pinched nerve, but in her case, she doesn't have a pinched nerve. Now, does that make it feel better or worse? Okay, a little tight. Okay, so that's more muscular spasm. So right up in here in her upper trap, we have a little muscle spasm. So what we're going to do is we're going to put a little gel, ultrasound gel, on the muscle itself, and we are going to set the machine And again, the machine is designed to heal up muscles and ligaments. There's a crystal that sends a frequency through a crystal that actually breaks up muscle spasm and helps dilate capillary beds to heal up muscle. You have to keep this phone head flat in a circular motion as we're working the muscle itself. It could be anywhere from 4 to 8 minutes depending on, and also we set the intensity and we set the different minutes. The patient feels nothing but a slight warmth from a wand on their neck itself. In this case, because we're limited on time, we're going to just show you, just for demonstration, that this would be how an ultrasound is performed.